characteristics of social media addiction are typically modeled on already established addiction frameworks. Researchers use 6 criteria: salience, tolerance, mood modification, relapse, withdrawal, and conflict in other areas of life to determine if a user may be at risk for addiction. And when use becomes addictive, the person becomes highly engaged, motivated by an uncontrollable desire to browse and devote so much time to this activity that it impairs other areas of life. There's a neurological factor as well, and it's well documented. Social media platforms activate the brain's dopamine reward system. So every like, comment, and notification triggers a release of dopamine in the brain. Facebook, Instagram, TikTok, they're engineered to be habit forming, and it taps into the very same neural pathways as narcotics do. But time alone, just time spent on social media platforms, is not the defining factor. Social media use or high social media use doesn't tightly correlate to the risk of addiction. So rather, the level of engagement is more relevant. So mindless scrolling, link jumping are riskier behaviors that may indicate a risk for addiction. The tipping point seems to be emotional function. Researchers suggest that a shift from normal to problematic use may occur when a person turns to social media as a primary or exclusive response or coping mechanism to stress, loneliness, and depression. And then there's this great debate, and it's very complex, that should this be a diagnosable condition by itself? Where we stand right now is there's no recognized set of diagnostic criteria for social media addiction in the DSM. Gambling disorder remains the only behavioral addiction formally included. And then internet gaming disorder sits in an area in an appendix that requires further study. So the field is actively debating whether social media addiction should follow the same path. The most defensible position emerging from current research seems to be a middle ground, that genuinely compulsive functionality impairing social media use is real, and it warrants clinical attention, but that diagnostic threshold isn't set high enough yet to basically avoid labeling ordinary or already established diagnostic criteria or disorder as a pathology.